How do surgeons prevent hematomas after surgery? Imagine waking up after surgery and finding a swollen, painful bump under your skin. That's often a hematoma. It's a collection of blood outside blood vessels caused by bleeding into tissues. But how do surgeons stop this from happening? Let's find out. During surgery, surgeons focus on controlling bleeding right from the start. They do this by carefully sealing blood vessels as they cut through tissues. This process is called hemostasis. They might use cauterization, which involves burning small blood vessels to seal them shut. They also stitch blood vessels closed with sutures or apply pressure to stop bleeding. Before closing the wound, they double-check that all bleeding points are sealed tight. This careful work helps prevent blood from leaking into surrounding tissues later. After the surgery, surgeons often place small tubes called drains inside the wound. These drains are connected to a suction device that pulls out any blood or fluid that might collect. Removing this fluid early helps keep blood from pooling and forming a hematoma. They also use compression dressings, tight bandages or elastic wraps that press down on the area. This reduces space for blood to gather and supports blood vessels, helping them stay closed. Some surgeries use special stitches called quilting sutures. These are placed to tack down tissue layers, eliminating dead space where blood or fluid could collect. Surgeons may also apply tissue sealants or platelet gels. These help seal tiny blood vessels and promote clotting, reducing bleeding. Patients play a part too. They should follow post-operative instructions carefully. Avoiding blood-thinning medications unless approved by the doctor is very important because these can increase bleeding. Resting and avoiding strenuous activities that raise blood pressure or cause strain helps prevent bleeding episodes. Applying cold compresses as advised can reduce swelling and support healing. It's also wise to avoid smoking and manage coughing or vomiting, which can increase pressure and lead to bleeding. If a hematoma does develop, early detection is key. Small hematomas might just need observation and compression. Larger ones may need to be drained by the surgeon to prevent infection or tissue damage. In short, surgeons prevent hematomas by sealing blood vessels during surgery, using drains and compression afterward, and guiding patients on proper care. This teamwork helps promote healing and keeps blood from collecting under the skin after surgery.